So is this visible, Professor Sen? Hello, Professor Sen, is this visible?
Yeah, visible.
Okay, okay. Good afternoon, all. Hope I will make your last session interesting for you. I heard today is the last, now is the last session, like 2:30 to 5. Hope you will enjoy the session. So today I will be presenting on effective computing, eye tracking to quantify effective states. Added to what, and this is our view of our beautiful campus at IIT Gandhinagar beside the Sabarmati River. This is all the academic building, and these are the hostels, and this is the Sabarmati River, and these are the faculty staff housing. So it's a very big area beside the picturesque river. So I'll jump to my presentation. So a very brief about my research experience and interest added to what Professor Sen has so well presented. So I mostly work in intelligent systems with having inputs from, say, eye tracking, biofeedback, which is physiological signals, peripheral and eye tracking based features. Signal processing is sort of my core interest areas. Of course, I do sensory fusion using data mining, machine learning. I have worked few years in quite a lot of years, not few years, quite a lot of years in industry even. So I take up process automation projects as well. And so far as academic interests are concerned, I mostly work in these three broad areas. One is adaptive human-computer interaction, adaptive human-robot interaction, and robot-assisted surgical techniques. So today I'll be presenting my work in the area of adaptive human-computer interaction. So a little bit on the autism, because this is the application where I use eye tracking to map it to the cognitive states. So very brief on what is autism spectrum disorder, why do we need to tap implicit measures such as eye tracking measures. So it's a neurodevelopmental disorder which is characterized by difficulties in social interaction, particularly when it comes to reciprocating to social communicators. And this becomes critical given the huge prevalence rate, the large prevalence rate. It's like nearly 1 in 150 in India and 1 in 68 in US. And globally, it is nearly 1 in 100 children having autism. So they have a very restricted interest, and their way of viewing the world is totally different. In fact, they exhibit atypical viewing patterns where they tend to more attend to the non-social stimuli rather than the social stimuli, such as the communicator space. And as a result, they have problems in understanding emotions of their social partners, particularly the non-verbal social cues, because particularly this becomes very critical given their restricted ability to express their own emotions and also understand others' thought. And then this leads to them being misplaced from the social communication or social interaction scenario. In fact, these children exhibit difficulties in adaptive functioning, planning in social situations, and of course, these have been shown in literature that considerably this is related to something of their cognitive state, such as the cognitive load, which becomes very critical in cognitive load, such as anxiety, such as engagement. So I'll come to soon how we can tap this cognitive states using different measures. And as a result, they cannot handle social situations because of these deficits. So therapists, in fact, often tell, and literature also shows, that intensive behavioral intervention at very early ages of the children's in a child's life, in a child with autism's life, becomes very crucial. And this can bring in a lot of advantages for them to overcome the problems. Now, you find that there are different types of social communication skills. Particularly here, I'll be discussing today that of the facial emotions, of course, mutual gaze, because when we communicate with a social partner, we reciprocate gaze, and of course, we sort of detect their facial emotional expressions and then accordingly reciprocate in order to establish the synchrony in the social communication process. So there are two main skills which one needs to target, particularly for these children with autism. One is collaboration with their peers, such as by shaking hands or sharing thoughts, and the other is to manage social conversation in a socially appropriate way. By socially appropriate way, I mean that there should be reciprocation, there should be turn taking, there should be identification of facial emotional expressions, there should be proper interaction, free flow of thoughts, and understanding others' thoughts as well. So in fact, if it comes to collaboration, the main components which are involved is planning for the action. So if one communicator starts a communication, starts a conversation, or starts an action, then or say proceeds one hand, so obviously the child should understand that someone is trying to do handshake and the child should reciprocate. So they need to plan the action and also in turn adapt to the situation while understanding the thoughts of the social partner. The other important skill is the social conversation skill, where the components are understanding the emotions being conveyed, and also managing the conversation, which can be different types of social exchanges. Either it is based on, say, proximity, or how much to position oneself from the communicator, or say understanding the different types of gaze patterns of the social communicator. So in fact, these are the conversation skills. So one is the adaptive behavior and the other is the conversation skills. So today I'll be mostly targeting the conversation skills and also a part of the adaptive behavior, that is understanding the insights of the social partner. Now where does the technology comes in all of these? So till recently, there had been a lot of traditional conventional based intervention techniques where therapists attend one-on-one to the children with autism for while employing various behavioral methodologies. These are very highly structured, where the therapist spends several hours with the child in multiple sittings, very costly and very expensive. But the problem is that the high amount of cost, considering, say, direct cost or the indirect cost, meaning the indirect cost, a child with autism is there and the mother comes with the child in the clinic to give the therapy, the mother cannot work. So that is an indirect cost also involved. So both direct as well as indirect costs are involved. So it becomes often inaccessible to the common masses. The other is these therapists are well trained and they use their expertise to understand the affective state, say whether the child is anxious or whether the child is engaged or not paying attention, and accordingly choose an intervention strategy in a very adaptive manner while understanding the cognitive load or the cognitive behavior of the child. But however, getting such trained professionals is often difficult because there are restricted supply of these trained professionals. They are specifically trained. So this becomes very difficult given the high prevalence rate of autism, which is also in a big way coming also in India. So one needs technology. So in fact, research shows that there are different computer technology, robotic systems, virtual reality-based systems, which can overcome such resource limitations, where you can program a robot or you can program an avatar in a virtual environment and give a task so that the avatar can understand the sentiments of the child or the engagement or the anxiety of the child and can change the intervention paradigm. So that is the need of the hour. Here in our research, we have chosen virtual reality. I have also worked with robotic systems previously as well for children with autism. But the problems of robotic systems are they are quite costly. They need trained manpower to operate, and getting robotic systems in India often becomes a challenge. So in our lab, in my research lab, I work a lot with virtual reality-based systems. In fact, virtual reality-based systems have different advantages, such as they're very controllable. They can ensure safety. One can dare to commit mistakes and then learn from the mistakes, because then the system, in fact, takes care and understand the sentiments of the child, and so the child can sort of learning by doing. The child learns through doing or through interacting with the social scenes being projected by the VR environment. But despite several advantages of virtual reality-based technologies, presently, the current state-of-the-art VR-based techniques does not provide quantitative estimates of one's cognitive load during a task. So, in fact, it is like a open loop system where, or I should say, partially closed loop system where the system responds based on the performance of the child. So sort of like interactive games in VR. But these are not serious games. So there is something which are coming nowadays in big way are the serious games, where the gaming environment is such that it understands the affective state of the child and can offer the tasks accordingly. So that is missing nowadays, still now. So in fact, the therapists are also trained. So we need some resources as a supplement or as a complementary tool in the hands of the therapist, where the VR can fit in very well. In fact, so that is what I was telling, that the task presentation needs to be precisely controlled based on one's cognitive load. That's very similar to the traditional approach, where the therapist and expert therapist offers the intervention paradigm based on the child's individualized limitations in social communication. How about designing a therapist-like virtual reality-based system that can understand one's cognitive load in a cost-effective manner? So that was the question which we were trying to solve. And that is where we have started using virtual reality along with physiology. So in fact, research shows that different physiological signals, such as peripheral signals, such as heart rate, muscle twitching, how I'm sweating, that is electrodermal activity, skin temperature, even gaze-related indices, what is my fixation duration, what is my scan path, what is my pupil dilation, what is my blink rate, all of these have relations to one's cognitive state. So how about tapping those? And this is what was sort of what we went for in our research. In fact, now the question obviously might be popping in your mind then, okay, if I am anxious, I'll be able to show anxiety. My eyebrows will squeeze together and I can make out that my child is anxious at my scolding, say, for a typically developing child. And then what's the big deal? Why will I go for tapping the eye, tracking eye measures or the physiological peripheral measures? What's the use for? Actually, this is very much necessary for children with autism, because these children have limitations in explicit expression of their affective states. They cannot express their emotions. They cannot express that they are becoming anxious. And it often happens that they go to a meltdown situation where nothing can be taught to them. So it's very necessary that we need supplementary or complementary measures to tap their anxiety state, for example, say. So that is where we need implicit manifestation, which can be done, which can be, or I should say, which can be accessed by tapping the physiological signals. And that is where we went on for our eye tracking. In fact, gaze-related indices can provide an estimate of one's cognitive load during a social task. And given that there are different types of gaze-related indices, we went for both behavioral and physiological indices, particularly behavioral indices By behavioral indices, I mean the fixation duration, how long I fixate on a particular region of interest, or how many times I fixate. So for example, I am fixating at a region of interest, say for 500 milliseconds, and I am for once. And again, I am fixating at the same region of interest, and another child is fixating same region of interest for 500 milliseconds, but that is divided into 2 times of looking towards the fixation, towards the region of interest. So in that case, in the latter case, the number of fixation counts is 2. So the average fixation duration obviously goes down. These are the beautiful aspects of looking pattern which we try to tap in our research. And by the way, please feel free to stop me at any point if you have any questions, and I would be happy to discuss. The other is the physiological indices, which is gaze-based physiological indices, which is pupillary dilation, that is how my pupils dilate, and what is my blink rate, how often I blink. Because these, both pupillary dilation and blink rate, have been shown to be related to one's affective state. For example, here, as an example, here we are choosing anxiety as an affective state. Now, the question comes, is the peripheral physiology, that is heart rate, say electrodermal or muscle twitching, are they as in par with the gaze-based physiology? In fact, it is. Research shows that pupillary dilation and heart rate variability are correlated. And in fact, also heart rate variability, electrodermal activity. By electrodermal, I mean how I'm sweating, that is my sweating activity. Of course, in my sweating, there are 2 ingredients. One is the tonic mean, that is the baseline level of sweating. That's the baseline sort of a DC shift in my which is recorded as a DC shift millivoltage in my output, in the output. And the other is the phasic mean, that is where there are sudden events, like an evoked potential, where I'm getting an output, and that is the phasic mean. So in fact, research shows the tonic mean component of the electrodermal activity, heart rate variability, and how often I blink, that is the blink rate, are all correlated. Here we chose the eye tracking, which I'm presenting today. Now, let me quickly touch base on the affective state. So I have been often telling that I am mapping my eye measures to the anxiety level. Why is it so? There are different types of affective states of the child with autism. Why am I so much interested in anxiety? It is one of the most common concerns in children with autism, and this is because this affects one's social communication, the way the person reciprocates. Also, this becomes very important while say in making academic progress or performing under competitive situations. So this anxiety becomes very important. So that is where we are trying to map our physiology to the anxiety state. In fact, one's looking pattern and gaze-related biomarkers can be clues to understanding one's anxiety level while participating in a task. How? There are different measures. For example, the fixation duration, how long one fixates towards the region of interest, that is the communicator space, and what the pupil dilation and blink rate are saying about the mental state of the child with autism. In fact, literature shows that the pupil diameter, blink rate, and fixation duration towards the face region all are related to anxiety level, with increase in pupillary dilation, increase in blink rate being related to increase in anxiety level. That in turn also is connected with reduction in fixation duration towards the face region. So this is what is there in literature. Now with this, we first wanted to know that can the eye measures be mapped to one's anxiety? So can we create scenarios in virtual reality that can create anxiety state in a child with autism? So we designed eye gaze sensitive virtual interactive social platform, which is EVISP, we named it. So the VR-based system consisted of three sub-modules. One is the virtual reality-based task presentation module, the task switching rationally, and the eye-gaze data acquisition system. The VR-based task presentation module had different subtasks. I'll come to the subtask soon in short. So subtask 1 and subtask 2. Now I'll come to what are these subtasks. And then based on the final execution of the task, we decide the task performance. That in turn is used to change the task challenge level, that is task switching rationally. At the same time, while the child attends to the task, we monitor the child's eye gaze and extract different features such as pupil dilation, the blink rate, and the fixation duration towards different regions of interest for offline analysis. So that was the first study which we did. So in the subtask 1, virtual avatar was designed, different virtual avatars were designed, and they enter the virtual scenario while introducing themselves, followed by a narration of social scenarios as the short social story. In fact, storytelling is considered one of the very good ways by which intervention is done by therapists. So that is what we adopted. And while the avatar narrated the scenarios, they displayed different types of context-relevant facial emotional expressions. Now the avatar also displayed a balanced mixture of straight and averted gaze. I'll come to soon. What is straight? Straight gaze is one when I'm staring towards one's face continuously. That is the straight gaze. And the averted gaze is one where I'm not at all looking towards the face, but I'm looking everywhere without the face of the communicator. So obviously both are extremes. So it is a balanced mixture. So there is a 30-70 rule by Colburn et al. So the 30-70 rule helps in designing the normal, which is the balanced mixture of straight and averted gaze. So this was the stimulus. So say, for example, one of the stimulus is the avatar comes into a restaurant environment and the avatar is narrating a story. Avatar's face region is chosen as one area of interest. Then there is any region outside the avatar's face region is the environment area of interest. While the avatar narrated the story, the avatar demonstrated different types of emotional expressions such as neutral, happy, and angry. So these were the three basic emotions. One is no emotion, neutral, and the other two are the two emotions on the two opposite sides of the valence scale, one positive and one negative valence. The arousal level remaining the same for both the emotions. Following this, the avatar started interacting with the child. There were different types of questions being asked by the avatar where the child has to respond to the questions. For example, there were context-relevant questions. For example, so let's give an example, say that the child has gone to a restaurant and while an avatar has gone to the restaurant and the avatar is explaining different experiences while moving around in the restaurant and telling the story to the child. So the context relevant question can be, where did the avatar go? So of course, if a child had carefully listened to the story, the child should be able to say, oh, it's the restaurant, and there are different options given to the child. The other is the projected contingent question, where the child has to reason out certain facts before coming to responding to the question. For example, the avatar has not discussed that the avatar has taken pizzas, for example, say. So the question might ask something in those lines where the avatar has not directly mentioned it in the story presentation, but the child has to understand that, okay, this is the McDonald's sort of restaurant which has been shown in the story presentation. There might be pizzas. So of course, the child has to think through. That is the projected contingent question. And other is the emotion recognition question, where the avatar asks, how was I feeling when I was narrating the story? Which is sort of the most difficult part to a child with autism. And then they were combined together in different weightage, with different weightage factors to design tasks of different difficulty levels. So these were tasks were of 3 levels: task level 1, 2, and 3, which I call it as TL1, 2, and 3. And then we implemented a task switching rationally by using a state machine representation where, for example, say it is TL1. So if, say, this is the performance, so if the performance is more than 70%, which is considered adequate, and then this is backed up by literature, then we increase the task difficulty level. And if it is inadequate, that is less than equal to 70%, then we decrease the difficulty level. So that was the sort of the task switching paradigm that we use. So for difficulty, for TL task level 1, if the child performed adequately, move to TL2. But if the task level 1 being the easiest one, if the child performed inadequately, then he was offered or she was offered tasks in the same difficulty level until the child got adequate performance, and then we did difficulty level 2. And in this way, the entire system went on. And after a particular duration of time, from any of the difficulty levels, the child could exit the task. Now, this was the experimental setup. The avatar, the child is wearing a Arrington eye tracker, which is like a goggles. While the child interacted with the social situation, we collected time-synced eye gaze data for subsequent offline analysis. So we used a viewpoint eye tracker. We designed a handshake module in our lab, and this was used to interact with or to connect the eye tracker to the VR-based task presentation module, which is a Python-based module. So the DLL was actually designed for the handshake module. And in turn, the eye data was being captured in a very time synchronized manner. And the eye data were, from there we computed the pupil dilation, blink rate, and the fixation duration. From the pupil diameter, we computed the average pupil diameter, the average blink rate was computed from blink rate, and from fixation duration, we obtained fixation duration towards the face and the fixation duration towards the environment. Now, we tested first with a very small population pool. There were 2 children with high-functioning children with autism and 2 typically developing children. We measured the SPINS anxiety, children's anxiety scale rating to see their baseline level of anxiety. And we took other measures for those working with children with autism. Will know that these are very standard measures: social responsiveness scale and social communication questionnaire, which shows their autism measures. Now, the results shows, now the results are very interesting. So we could see that this is, these 2 are the children with autism result, and these 2 are the typically developing children. So we can see the children with autism, in the maximum possible cases 50%, but most of the time they were hardly 25-30% looking towards the face of the avatar, and they were looking somewhere else, not towards the avatar. But that was in contrast for the typically developing children. They were like 80-90% times looking, except in one case, one of the typically developing child was looking less towards the avatar's face, but still it was more than the fixation duration of a child with autism. Now, you can see that the question, now you can make out very easily that this is the fixation duration towards the environment. So since the child with autism were not looking towards the face of the avatar, they were looking more towards the environment, but the typically developing children were looking less towards the environment because they were looking more towards the face of the avatar. Now, outside the visual stimulus, that is outside the computer screen, you can make out the children with autism were looking, in fact, more outside towards the screen, but the typically developing children were looking towards the screen, and in fact, they were looking more towards the children with, more towards the face of the avatar. And the performance score, you can see that the performance of the child with autism was much less compared to a typically developing children. And also you can see that the percentage performance score goes down with increase in difficulty level. Here, for one of the participants, we could see that there was an improvement. In fact, for the other participant as well, there was an improvement, and then there was a reduction. We could see that there was the difficulty level 1, TL1 was the first task which was offered, and so there was a novelty effect, but there were some practice effect in the difficulty level 2, that is TL2, and by the time the task level 3 was reached, that was much more difficult, so the performance went down. But in any case, all the typically developing children were always performing better than the child with autism. Now we wanted to see what happens to the pupillary dilation, because pupillary dilation will speak on the anxiety level. So we can see that with increase in difficulty level, generally so for the particular ASD2, you can see that the pupillary dilation is increasing. So increase in pupillary dilation is related to increase in anxiety. But for the child with autism 1, ASD1, you can see it's more or less remaining the same, which in fact lays emphasis on developing individualized system. Each child is typical, each child is sort of different. But for the for the typically developing children, you can see that they're more or less the same, but they were much higher, though they were much higher because they were much more involved, but there was not an increase, but it was more or less the same across all difficulty levels for a typically developing child. So things were different for the child with autism. Again, for the blink rate, we can see that the blink rate also varied across the individual difficulty levels. So this shows that the eye tracking technique has potential to be mapped to the gaze-related indices, and that is mapping it to one's anxiety. So if so, how about using eye tracking data to extract the anxiety and in turn change the game paradigm? So that was sort of our intent. Also, we wanted to see that, okay, how about how the child responds to different emotional expressions. So what we did an extended study where the gaze data acquisition module was used to extract gaze-related indices such as fixation duration towards face and non-face regions, also count, that is, which I was telling, the number of times or the number of hits towards one region of interest, that is face and non-face. Also the average fixation duration, that is the total fixation duration by the fixation counts, which can be grouped as behavioral indices. Now, 8 pairs of children, like 8 children with autism and 8 typically developing children took part in the study. We used standard procedures for conducting the study. And this was the experimental setup. Now the results are again very interesting. So we can see that overall, this is the autism. The first one is the straight lines are the autism, and the oblique, the slanted line bars are the child, typically developing child. So we can see that the children with autism were hardly 60% percentage performance, and 70% was the sort of the threshold which no child with autism could achieve in any of the emotions. But the typically developing children could easily achieve 70%, whatever be the emotion. Another interesting finding is the typically developing children were very comfortable in performing for the happy facial emotional expression. But in contrast, typically an autism child was more comfortable with the neutral face, that is where there was no emotion, where the performance was the maximum among the happy, angry, and the neutral. Again, we wanted to see what's the distribution in the fixation duration, the percentage fixation duration. Again, we can see a very interesting thing. For a typically developing children, the percentage fixation duration towards non-face was always less than that towards the face, which is just the contrary in the case of child with autism. The percentage of time they spent towards the non-face regions, that is outside the face region, was more than towards the face region across any emotional expression. Also, we can see for the angry emotional expression, the percentage looking towards the face was the least compared to other emotional expressions. So This made us think that, okay, if this is so, the gaze-related indices are so different between typically developing children and children with autism, can these be used as characterizing elements or sort of characterizing features, or can these be used to distinguish a child with autism or from a typically developing child? That is sort of a diagnostic tool. For this, we tried to use different classification techniques. For example, we were interested in intragroup, that is within child with autism and within the autism and the typically developing children. We use different types of Glaze classifiers, classification trees, regression trees based on network, support vector machine. And the features used were the fixation duration, the counts, the average fixation duration towards the face, and the non-face regions. And the results were very interesting. So we can see for the intragroup, that is within child with autism and within children with typically developing children, the SVM performed the best. So this 95% shows that when 95% of the time a child with autism could be classified while viewing the happy face versus the rest of the faces, that is angry and neutral. And likewise for the typically developing children. So we can see that at least 85% of the time, both child with autism and typically developing children can be distinguished within themselves while responding to different emotional expressions. Then we wanted to see what is the intergroup, that is child with autism and a typically developing child. So here we can see that, again, using all the 4 types of classifiers, we can see that, say, for happy emotional expression, a minimum of 94% of the time, typically developing child can be distinguished from the child with autism. For the angry emotion, is 100% of the time how a child with autism looks towards the face and how a typically developing child looks are totally different. So it can be very used as a diagnostic tool. In the same way, about 90%, really 90% of the time, the worst case or SVM was performing the highest in that case as well. 100% of the time, a typically developing child and a child with autism, while viewing neutral face, can be distinguished. So the results were pretty interesting. So we could find out that the behavioral indices were helpful in distinguishing the autism and the typically developing child. That is, an intergroup classification can be very easily performed based on how eye tracking measures can be used to estimate one's affective state. So we went ahead to see other parameters such as proximity and eye gaze pattern. In fact, in our research, we have seen various aspects of how one's looking is being affected. Here, I'm going to present only a few of them. So we wanted to see what proximity has effect on the gaze pattern. So a little bit on proximity is, this is a social platform. We developed a social platform which focuses on interaction between a social partner, because the distance between partners is something very important while communicating in a social interaction. We wanted to see what's the relation between proximity and eye gaze. In fact, we used standard proximity measures, which are in literature. There are different zones. We chose 2 of them, which is, in fact, there are 4 zones. We chose 2 of them. It is intimate zone, which is less than 1.5 feet, that is invasive. Another is the social zone, which is 4 to 12 feet decorum. These are all in physical space. We emulated them in virtual space. Now the question obviously comes, why we are doing all of this? Does it make sense? Why we are looking for social proximity? What is this importance? In fact, literature shows that the social proximity plays an important role in social communication with relevance to the equilibrium theory, where it says that proximity and eye gaze are sort of interrelated to each other, and they are modified based on compensatory mechanisms. How? In fact, it depends on whether the speakers or the communicators are dynamic or static. For example, in a physical space where the one can move, like I am speaking and I'm speaking to someone in a room, to a guest, and there is a physical space where we are located. So in that case, if the listener has issues with the distance, what the listener will do, the listener will just walk back or increase the distance or move away. That isn't possible in the physical space. And of course, it also will affect the listener's gaze behavior, the way I'm responding or reciprocating to the communicator's bit. But however, in static conditions, we will avoid eye contact. That is, we will blink more. So in order to avoid eye contact, we will increase our blinking rate. These are in static conditions. But these are very much have been reported in literature as far as the physical space is concerned. Nothing has been presented in literature as far as the VR or virtual space is concerned. We wanted to see whether the same holds good, even in virtual reality-based environment. So, in fact, you will find that when it comes to social gaze, there are two broad types of gaze. In fact, there are three broad types of gaze. One is the straight gaze, another is the averted gaze, another is the normal gaze. Now, the straight gaze is one continuously looking towards the speaker, which can make the speaker engaged and anxious, right? And in turn, in order to establish the equilibrium, the listener will try to avoid eye contact. The listener might blink more because the listener cannot move back. There is no physical space. They will try to blink more. And the other is the averted gaze. That is, the speaker is never looking towards the listener, but is continuously looking in all directions without giving a straight gaze. Of course, very annoying, very disturbing. In that case, the listener will lose interest and will avoid eye contact again. And the third one is the normal eye gaze, which is a mix of straight and averted gaze, generally 30% straight and 70% averted by a speaking communicator, again, very well established in literature. We wanted to emulate it in virtual reality. So we designed a study where we used a factorial design 2x3, where avatar's proximity had two options, that is invasive and decorum, and the eye gaze had, so here you can see both the avatar one is at invasive distance, quite close, the left one, and the right one is at decorum distance. And the eye gaze had straight, averted, and normal options, both being at decorum distance. One is straight and the other is averted. And of course, we can give a mix of straight and averted to give a normal. So we had 6 combinations, 3 each for invasive and decorum. In fact, we were interested to see whether the decorum normal combination elicited could elicit comfort condition or less anxious condition, and can it be verified using gaze physiology or gaze measures. So that was sort of our research question. So we designed virtual environments where we divided the environment into different regions of interest, the face region and the non-face regions. And same way, we had the virtual reality-based tasks, the story session, conversation session, and the gaze data was being acquired for offline analysis. In the same way, we extracted different gaze features, face fixation duration towards face, non-face, count towards face, non-face, and average fixation duration towards face, non-face. These are various behavioral indices. And a group of 14 pairs of ASD and TD, that is 14 children with ASD and 14 children with TD, age-matched children were recruited for this study. We used an eye tracker along with a chin rest for the children. Now, this is the performance. Now we can see that, so on the left, we can see of this dotted bar is for the decorum and this is for the invasive. So you can see every time, except for the invasive, for this is the averted, this is the normal, this is the straight eye gaze. The normal, decorum normal was the highest. Decorum normal was the highest, right? But for invasive, things were different because they were trying to blink more and they were not looking towards the stimulus. Also, another interesting thing is that the typically developing children were always performing better, irrespective of whatever it's invasive or decorum, compared to typically developing children. The typically developing children were about, say, 40 to 45%, or 50%, but these children were nearly 80%, typically developing children. So we could find that the decorum normal combination was eliciting the best among the child with autism or even typically developing children, barring the invasive configuration. Also, we wanted to see that the children are able to do well. Are they looking more towards the face? Because that is what is important. It's in a social task, it's not how well we perform, but whether we are really looking towards the face of the avatar, then only we will understand the emotional expressions of the avatar. We should look. So we could see that the percentage fixation duration, again, for typically developing children was more than the children with autism. But however, again, the decorum and the normal gaze was giving the maximum performance for both the child with autism and the typically developing children. Of course, the values were less for invasive compared to the decorum. So you can see it is hardly 10%, around 10, 12% here. It is around 20% here, even for within the children with autism. And same for the typically developing children. For invasive normal, it was say 42%, but for this, it was like really 56, 58%. They were looking towards the face of the avatar. So again, the decorum normal was good for both the child with autism and typically developing group. Similar, we could see the average fixation duration, which is again for the decorum normal, the child with autism was looking more towards, and on average, more towards the face. Same also for the typically developing children. So again, the decorum normal combination was working better for both the ASD and the GD groups. So we could see that the performance was higher during decorum normal situation for both the ASD and the typically developing groups. And this decorum normal situation was contributing maximum of fixation duration towards the face region, average fixation duration towards the face region. And so to summarize, we can say that one's gaze indices can speak on the preference towards decorum proximity and normal eye gaze during social communication, and along because this is all only possible because they are getting less anxious and, in other words, greater comfort. So our idea was that you can make a child to learn a concept if the child is less anxious and comfortable. If the child is working under anxiety, they won't be able to catch or the basic concepts, or the learning would be sort of limited. So how about bringing in such a situation for these children? Particularly true for children with autism because they have anxiety disorders. Next, we designed, so we know that the anxiety can be represented very well through the gaze measures. Now, there is another important aspect in social communication, like we discussed proximity, we discussed emotional expressions, we discussed the combination of proximity and eye gaze. There's something else, which is collaboration, right? Which I was discussing in the very first one or two slides. So we designed a collaborative virtual reality-based interactive social platform, which we named as CIBIS. It was a bigger study, and we had a patent application also done based on this study. Here I will present only a short summary of the study, mostly geared towards the eye tracking aspect of the study. So why we came about with this platform? Because putting oneself into the shoes of the others is very important in social interaction, and that is a problem in these individuals with ASD. For example, I say, tighten your belts. So obviously it's a phrase. It has an inherent meaning. It means that be particular or be punctilious about what you are doing. But a child with autism will not understand, right? Will not understand. At the same time, say I am speaking to someone in a social setting, and that communicator has an issue or having some problems, is not understanding, or somewhere there is an issue and I am not being able to understand the issues of the communicator, then our social communication will be adversely affected. So in other words, we need to know the thought of the social communicator or the partner in order to take the discussion forward properly. So that is sort of missing in the children with autism. In fact, the interactive community, interactive fiction games doesn't also look to that aspect of the social communication, which we are trying to develop here. So, in fact, understanding the partner's preferences on a topic of interest often leads to restricted reciprocity among the children with autism. So, in conventional intervention, how does the therapist or the educator encourage this, this notion in the child? So, the therapist, such as in a drawing task, encourages a child to take part in a collaborative task. The task is, say, building up a painting collaboratively, right? So, for example, as shown in this figure. So, what the therapist will do? The therapist will tell the child to draw scenes from real life in social context, real life social context. For example, say the child draws a school bus, right? So the therapist might draw, okay, then there is smoke coming up this school bus. Say the child draws, okay, the school bus is going on a road, then the therapist will draw signs on the road, right? So in this way, the story will proceed. Then the child draws clouds, then the therapist will draw rains, right? So in this way, the story building proceeds. So, or in other words, creating a story. And finally, the educator will narrate the scene in the form of a story as a feedback. And that is what sort of we try to bring in through VR. So the child, a child might feel that I prefer X, say a friend, I will go with X, but someone may think that he prefers X, but I prefer something else, but it's okay, let me support him. So this is like someone preferring something else. To understand that is understanding others' thought is very important, which is lacking in a child with autism. So you will find that the currently existing multi-user platforms do not feature these mechanisms where one communicator will understand the thoughts of the other communicator or the partner on a particular topic of interest while executing a task. The literature shows that there are different types of gaming scenarios where, say, building of a bridge, right? So they are like, or the building of a zigzag or a puzzle. So these are very methodical games, and this is more on logical reasoning rather than understanding the thoughts of the partner. So we wanted to do something deeper. How about giving them a story canvas, and so that they can develop the story. So that was sort of our thought. So the question was, why a child with autism cannot follow the thought of a partner? What is the basic reason? What is actually preventing them from doing this? And that is where we started our search. Now, to develop such an environment, we used an application. We developed a CWISP application layer, a Python-based application layer, which had different components like a collaborative task framework. We had an intelligent story developer engine where we asked the children to create stories, which I'll come to soon, along with the feedback and storytelling session. And while the child interacted, the children interacted with the social scene, we monitored their eye gaze measures. So we gave them, on the computer screen, we gave them a story canvas. So this is the story canvas, the central portion of the screen that was empty, and the side, the periphery, had different objects like scenes from real environment in a very virtual setting. And the children were asked to populate a story, like frame a story. And these objects belong to different contexts. For example, there were like landscape contexts, there were playground contexts, so different types of contexts were given to them. Now, these children, in fact, used turn taking, and they developed the stories. Right. For example, say someone clicks a valley, then someone clicks a mountain. Right. So the child should understand, oh, hey, my friend wants to develop a landscape scene. Right. Right. Then someone says a river. So they drags in a river, just drag and drop on the center of the screen. And then the friend will understand, okay, then someone needs a boat, then someone will drag a boat. Like in this way, the story will start developing. And then there is a feedback canvas, which is provided, like thumbs up, thumbs down. So if I am playing with you, and I'm trying to develop a story related to landscape, then you as a friend will understand that, oh, hey, she's trying to develop a story with a landscape, so let's build a story around that, right? And then in that case, we provide a thumbs up. But else, say, if you are playing and you are designing a story related to a railway station, then I should understand, hey, my friend is trying to design a story of a transportation, so let me try to develop a railway station story related surrounding around that. So that was the sort of the overall idea, all developed in VR using Python environment. So the story developer engine, and that is something I felt like to share here in this session today as an example. So this we used lexicon. So this is totally based on use of AI, which I'll not go into details because the time will be limited. So we used lexicon and relationship as per the hierarchical structure, which is there in literature. For example, we were designing the landscape scenario. So these are like individual nodes in a tree structure. So for example, the valley is there. So this is the valley. And then there is the hill. So we can say the hill is on the valley, or the valley is below the hill. So obviously there will be a bidirectional relationship. Now we can say the plants are on the valley. We don't say the valley is below the plants, right? So the plants are on the valley, so unidirectional. And then we can say the river is flowing beside the hill, or the hill is beside the river. So it's bidirectional. So in this way, we develop a hierarchical directed graph architecture, which we sort of give in the database of the story generation engine. Now, based on the hierarchical architecture, the system will understand, and then at the end of the story narration, an avatar will come in and design a story surrounding that and communicate it to the children developing the story. Now, say, in addition, we raise different exceptions. For example, say if we provide a nest, but there is no tree, then we provide hints to the children. Our system provides hints, again using AI engine, that we see a nest, but where does the nest lie? In order to give hints so that the child can bring in trees or place the nest somewhere else. Now, while the children interacted, we divided the stimulus into different regions of interest, particularly the story canvas region of interest, the VR object region of interest, and the feedback canvas region of interest. And we computed different indices such as fixation duration, fixation counts, and time to first fixate. That is how much time is required, sort of reaction time, to fixate on a region of interest. Now, we used an eye tracking, non-invasive and remote eye tracker, desktop-mounted eye tracker, and we extracted different features, like these are feature baskets. Some are percentage fixation duration story canvas, percentage fixation duration virtual object canvas, and feedback canvas. The gaze feature basket 2 was the counts divided among the story canvas, virtual canvas, that is virtual object canvas, and the feedback canvas. The gaze feature basket 3 was time to first fixate relevant. That means, say, for example, I'm developing a I'm using a valley to click because that is the valley or the mountain I want to click it because I'm developing a story based on a landscape. And then how much time I take to fixate on, say, the mountain. But irrelevant can be, say, if I'm developing a story on a landscape and I choose something on a playground, right? That can be irrelevant. So what is the looking pattern? What are the gaze measures corresponding to the irrelevant region of interest? And finally, the gaze feature basket 4 was fixation duration turn A and turn B. That is, say, when I am trying to click or choose a particular object, then how much time I'm looking towards the stimulus. And when, say, my friend is trying to choose an object, how much time I'm looking towards the stimulus, which is actually the one I'm trying to show here. And so I'll be focusing on the gaze feature basket 4. So here I'll focus on, so I've left the rest of the study and I'm just focusing on the gaze feature basket 4. So here you can see the two environments have been created. So you can see this is one, that is someone has chosen the mountain, then someone has chosen the nest, right? That is the player B. Player A again comes and chooses the river, but the player B goes to the car, that is transport scenario. So obviously there is a unwanted flip between the scenes instead of developing a same scene, right? Now we keep a track. So we see how much time the player A looked towards the star stimulus where the player A was playing, and then how the fixation duration turn B is how long the player A looked towards the stimulus when B is playing, that is the partner is playing. So we can see we recruited about 18 pairs of ASD and TD children, and then they were player A and the system. I'll give only a part of the data here to show the looking pattern, the significance of the looking pattern. So in phase 1, the participant interacted with the experimenter. In phase 2, the participants interacted among themselves. So that is 2 children with autism or 2 typically developing children were building up the story in the case of phase 2. Here you can see on the right side of the screen, the child with autism. So the red are in phase 1 and the blue are in phase 2 in each case, right? So you can see that while the child with autism, one child, that is player A, is playing, player B is actually not looking towards the screen. But in the case of here, so it is much less, A is the child. So, but when the child is playing, player A is playing, player A is looking towards the screen. But when player A is playing, player B is not looking towards the screen. That means that is where they are not able to follow the thought of the partner because they are not looking towards the moves of the partner. But in contrast to typically developing children, irrespective of whether they are playing with the experimenter or playing with the partner, and whether it's the player A or the player B is playing, they are always looking towards the screen, and that's why they are being able to perform better. In fact, a child with autism, the total cumulative sum of fixation duration is about 45 or 45%, but for typically developing children, nearly 88%, they are looking towards the screen. So here you can see like 48 and 40 is like 88%. And here you can see 20 and like 25, so like 45% nearly, they are looking towards the screen. Rest of the time, they are simply looking outside. So we could make out that the child with autism doesn't look towards the player's moves, and that is where the child is missing the thoughts of the partner. So, Dr. Sen, can I take another maybe 5-6 minutes more?
Yes, of course, Dr. Lahiri, please go ahead.
Okay. Thank you. So then I try to see, okay, can I use different combinations of gaze feature baskets and use that while developing the story as a diagnostic tool for a child with autism, how do they characterize, how do they differ from a typically developing children? So we can see that a minimum combination of 3 gaze feature baskets, or even 4, obviously 4 will be better. We can see that particularly the SVM gave a minimum of 98% accuracy to classify a child with autism from a typically developing child. So that means if even when the 2 children are playing and developing a particular story using a virtual environment, during the process, if we can monitor their eye gaze, then also we can simultaneously decide, okay, does this child has problems with social communication, or is the child is in the autism range or not? So that also we can say that we can see that nearly with 98% accuracy, it can be used to classify. Of course, the SVM was the best across all. So even for 3 groups of gaze feature baskets, you can see nearly 100% of the time, the support vector machine was able to classify autism and from that of their typically developing counterpart. To conclude, these are the so in fact we work with children with children with autism. That's one of the application, and the other application is where I work with individuals with movement disorders, where we design different types of wearable portable devices because we are in diagnostics and rehab as well. So this is one of the smart eye where we came up with eye gaze measures. How can it be used to find out the dementia level or the depression level of or the cognitive health of individuals? So this was a bigger part of a bigger study, which was nearly with 1,700 participants at community centers of Hooghly, where we did this study, and also we got a US patent from this. Again, that was a role of eye gaze. How can it be used to map to the cognitive state? We came up with also with One Touch Doctor. So it is a non-invasive near-infrared spectroscopy-based body vital measurement device, which we came up with, which can measure different parameters, particularly the hemoglobin, so which is responsible for anemia. So that also, without any prick of blood, we can compute the hemoglobin in a very non-invasive manner. Also, we have come up with different devices, portable devices, to understand the possibility of freezing in Parkinson patients. And one of my PhD students from who did her MTech from NIT Durgapur, and she is actually working with me now, Priya Pallavi. She's a very bright student, and she is working on a wearable portable device for detecting the possibility of freezing of a Parkinson patient, and then providing cues. So again, a big area of research, which we have also got a patent application filed in it. We work on the, apart from the autism, which I already presented today, we also work on with patients with stroke, particularly balance and gait and the upper limb rehabilitation. These are again different lines of studies which we also are involved. My lab is involved, the IRAX lab is involved. I acknowledge the funding support from different funding agencies like DST Tide, Indo French funding agencies, SERB, Cognitive Science Research Initiative, BIRAC, DST A-STAR, for funding my research that has been possible. These are the references. Also, I acknowledge the contribution of my PhD students and my collaborators. And thank you. This is a view of the hostel, and you can see it's a sunset. So I started with rising sun towards the start of my talk,